Different categories of healthcare workers, both at the federal, at the state, and at the local government level. Someone can go to school and graduate as a nurse. Another person can go to school and graduate as a midwife or a dental technician. They can go to the same school, but they don't have the same qualifications, and they are not employed at the same level. For instance, somebody goes to the School of Health Technology. What you are producing there are community health officers, community health extension workers, both the junior CHU and the senior CHU. Even though they have their role in the health sector, they are not employed as nurses. So they will not earn the same thing as a professional nurse who went to a nursing school. So that is the explanation. Now, what happened with ASHWOS? You know, ASHWOS is the Abia State Health Workers Salary Scale. And that prioritized, the idea was to make sure that we reduce the immigration of health workers. And who are the health workers that immigrate most of the time? It's doctors, nurses, pharmacists, medical lab scientists. So His Excellency focused on those people and ensured that they were given the same salary package as their counterparts at the federal level. Then he instructed that we should do an enumeration to be sure, because we were getting different numbers from the local governments. Some will give 4,600, some will give 4,800. But we needed to know the exact number of people to be paid. And I can tell you, when we finished the enumeration, we discovered there were 400 workers who were being paid, who were not working. So that saves this state at least 20 to 30 million naira a month. And that's what His Excellency said. And immediately that was verified, he quickly approved the LG health worker salary, which is what we are announcing today. There are very few states. Abia is one of the only few states that have approved this payment for local government health workers, including those ones who went to the community, to the School of Health. They are the ones that are going to benefit from this package. That same CONHESS that nurses are being paid, that they are going to be receiving now in their own category, because there are categories of payments. Even among CONHESS, you have categories, and that is what the state has just implemented, and that has removed any dichotomy in the health workers' salary. And I think it is something to be very grateful for the government we have now, that prioritizes the welfare of all workers and including health workers, because already the nurses were earning that. Now the other workers are going to earn it. If there is anything to boost morale of workers, I think His Excellency and this government deserves a pat on the back, because that's exactly what has happened. The other thing to look at is the fact that we are also recruiting health workers to ensure that the gaps are being filled. As I'm talking to you, about 500 nurses are undergoing documentation now that they recruited. Apart from that, other health workers, pharmacists, doctors, consultants, dental officers, radiographers, radiologists are being recruited. The recruitment exercise will soon be over, and these people will be injected into the workforce. So the workers, to answer your question, I believe I have done that, is to tell you that they are the ones that are going to benefit from this pay package. And there is no more dichotomy. That you went to the same school and you graduated with different things. When you go to the bank, you have those that are bankers, you have those that are finance people, you have cleaners and all that. That you work in a bank does not necessarily mean that you earn the same salary. People are paid according to their grade and according to their professional profile. Yeah, I'm not going to, because there are different categories of nurses. You have the NOs that are just starting work. You have the chief matrons. So it is a very large category. But I know that nurses are earning what their federal counterparts are earning in Abia State. And in fact, they are actually earning a bit more than the federal workers. So we have done a staff mapping, a mapping of the requirements in the Ministry of Health. And in fact, again, Abia State is one of the states that have done that. In fact, it's one of the World Bank's requirements. So if you go to even our website, you will see the mapping of the Abia State health workforce. And for every year, you will see the number of people we need and the categories. The people you recruit will be based on need. And so we have a needs assessment that showed us the number of people we need. Now this year we started with 771 to inject into the workforce. Next year, we already have the number that we're going to, and their categories. We are not going to employ public health workers if we don't need them. We are not going to employ environmental officers if we don't need them. We will employ those that we need to help us meet the healthcare targets of the state. Thank you very much.